because this year the result was pathetic. That FMG result, that was pathetic. It was just 16%. Out of 60,000, 53,000 plus people failed. And many of them, they were giving sixth or seventh attempt. So you can imagine, मतलब कुछ emails आई है, जब उनको बोला था कि पहले से पढ़ लो, नहीं, थोड़े से क्वेश्चन कर लेंगे चल जाएगा, नहीं होता, नहीं, it is not like that. So this time's FMG result, it is very strict. In fact, the questions they were asked, they were so simple, and that's why I have put this something awesome for you. We'll be so pleased just to have this particular file. Yes, I know that there'll be some emails where it will be said that ये चीज तो final में भी नहीं पढ़ाते हैं, but exam में पूछते हैं. They ask you these things in exam because they want to know that how powerful are you into your concept, right? And you'll find that once you see that, it is not that complicated. It is a matter of understanding. And thank you for all those mails, good emails, where you have given so much support to me, right? Where you said that, yes, you are understanding the points, etc. Thank you so much. Now for the test. एक काम करते हैं, right? Test देनी है ना, right? Here is our channel, right? I thought, up, I trust you, right? Go to playlist. In playlist, this is Anatomy Journal View full playlist. See, here is the exam, right? This is कहाँ पे है? Journal Anatomy Test 2, right? This one. Appear for this test after completion of our today's session, right? And just let me know the score. This is same recording only, right? It is exactly in the same style. Appear for this test, and once this test is complete, right, we'll be solving all the problems and appear for it, right? At your convenience, but do that, right? Today only. And what we shall be doing today, I'll just scroll through all the exercises. See, within no time, suddenly you'll start feeling that they are not normal, right? They are not normal. All the craziest disease, but commonest, so common, right? All these. And you must have noticed one more thing, that this is one X-ray, same X-ray is getting repeated on the other page, right? It is repeated on the other page. So on one X-ray, I'll be writing all the findings. We'll discuss it. Today is not a matter of one-way communication. Today it will be like a two-way communication. I'll not be telling you that straight away, okay, this is, say for example, this is a kid, right? And but what you are watching, I want you to observe, watch, and tell me that what do you see? Sahi galat mat tension lo. And then we'll systematically analyze it. By the time we'll reach to the fifth X-ray now, right? You'll start thinking it in that way, right? Same thing we'll do it in the form of ECG, right? First we'll learn simple ECG, and then dhire dhire ek component will keep on start adding, so that when you finish it, you should be able to write. By our today's target, by the end of today's session, you should be able to write a radiology report of X-ray chest. You should be able to write a report, right? You should be able to write a report. Bas. So that's why we'll be making a pattern, and we'll keep on following the same pattern for every X-ray. When our today's session is over, there'll be one blank X-ray, and on one it is written. So what you do is, don't study it today, because today it will be clear in your memory. Don't even revise it. Don't revise for 2 days. आज और कल revise मत करना. Monday को open this file and start watching those blank X-ray. Can you figure out what it is in? Can you write a report? Right. So if you have understood the concepts properly, you'll be able to write all those 12 reports. And I want that you send those reports to me by the email, right? So on not 12 individual emails, right? Don't do that. In one email only, just write all those 12 reports. So whether you write it with the hand and take a picture, put all the pictures in one PDF file, or whatever the way you like. You can type even into your email also. But yes, I want to see that how well you are following it. So all these. See, this is one X-ray. Okay, one X-ray, same X-ray is this, right? So that's the plan for today. And also you'll be sending your scores. Okay. 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 So many emails, so many messages. Test today, right? Test this way. We talked about till our cholesterol. Should we just go with the flow that? अभी के लिए तो we just go with the flow. But I'll let you know. Test मतलब there is no. मतलब I'll not be taking tests. You have to just do the test from the YouTube. Atharu, I have taken admission yesterday. How can I connect? Okay. Send a mail to me. I'll tell you in more detail. On email must is till you are Mbbs. Gmail. Just send a mail on this. I'll send you all the links. One more email was there that should we make notes by watching the videos? No, you can make notes, but the PDF will always be available, right? So I'll send you the link. I don't remember the person's name, but just send me the link. Just send me the email. I'll send you the link where you'll get all the YouTube channel. YouTube channel is very simple. It is just my name, right? So you can even type like this, that youtube.com and /@ and then write the name, right? And you will land over there. Right? Easy to reach. Okay. How many of you are writing diary every day? Even 2 lines?
So writing in notes.
That's fine. That's fine. Writing in notes, digital or physical, anything is fine.
Yes, sir.
Huh. Still very less. About 20. Okay. So let's start with our first extra today. What do you see in this? I'll put this
Sir,
thing.
I'm sorry to interrupt, but actually I'm traveling. Can I please record the session?
Wait, just a minute. You can. So you have to tell me that what do you see in this X-ray? Your
Hydraulic structures around the heart.
voice is cutting, Kulshan. Voice is getting very much choppy. Uh, okay. Who will take the initiative? Aditya, you'll speak.
So the diaphragm is slightly high on the right side.
Okay. Is it normal or not?
It's normal, sir.
It's normal because on right side you got the liver, so that
Right
is
side we
normal.
have
So this is right side
liver.
diaphragm is high. That is the correct observation, but it is normal because of the liver. So that means we are watching over here. What is watching is liver.
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 Sir, the
Okay.
X-ray is normal, right?
Exactly. This X-ray is normal X-ray, right? This X-ray is of a young female. It's a normal X-ray, quite reasonably centered, properly centered. How do we know that it is reasonably centered? Because what we see is this is the clavicle, right? This one is clavicle. Now, if it is exactly centered, if the patient is absolutely parallel to the X-ray plate, so then this spine will be lying absolutely in the middle between two ends of clavicle, which is not in this case. It is the patient is slightly rotated, but doesn't matter. Doesn't matter. It is quite okay. Okay. So that is one. So we learned about the centering part. That is one. What is this? What is this? This black one? Black thing?
Trachea.
Trachea.
Okay, chalo.
Trachea.
This time what I'll do is I'll randomly pick a person and he or she has to say. ठीक है? So this will be a sort of viva. Gajendra More, unmute yourself. I'll be asking you two questions. Very fast, फटाफट, क्योंकि अभी खूब सारे एक्सरेज हैं. चलो.
हाँ सर.
हाँ. So what is this? This black shadow?
Esophagus.
Esophagus? Which other tube is over there?
Sorry sir, it's trachea.
It's trachea, right? What is the importance of this black shadow? It is trachea. So that is now onwards, we'll call it tracheal shadow. So what is the importance of this tracheal shadow?
Sir, it means is filled with the air.
Air is there. Air is there.
Yes.
But what else? No problem, Rishikesh. I'll send you the link again. And okay, Falak, this is your first class. No problem. No problem. Just send a mail to me. I hope you have got the email. Okay. All right, Nisha. Just lungs. Just lungs kya? That's fine. Chalo.
Yes.
Yes, Gajendra. Importance of this फटाफट क्या था importance? Question open to everyone. What is the importance of this black shadow?
So the mediastinal position.
Exactly. It is the if it is shifted right side or left side. Mediastinal.
Sir, by SOL.
Right? By SOL or fibrosis. It can be pushed or it can be pulled. Right? So if there is SOL, space occupying lesion, SOL, space occupying lesion, so as it will grow, it will push the trachea on the opposite side. Now this would be like a hard substance. There cannot be any air. So obviously it will be looking clear. Right? So it will show that we'll say that it is giving us the push effect. When there is fibrosis, so then fibrosis, the structure of fibrosis, it will look like a very reticular mashy pattern. So it will pull. So that is what is called as the tracheal shift, right? All right. So here it is in center, so mediastinum is fine. And this spine, it is pretty center between two ends of clavicle, so that is also good. Okay, so that is one thing we talked about, say, tracheal shadow, right? It is called as the tracheal shadow. Shriji, unmute.
Yes, sir.
Right. What is this? Fadafat.
Erotic knuckle.
Shabash. It is aortic knuckle. This is left side of the wall of the heart. Correct?
Yes.
It is formed by which chamber? Which chamber? Out of 4 chambers, which chamber is forming this area, this arrow where it is being marked? Question open to everyone.
Left ventricle.
Left
ventricle.
Left ventricle.
Okay. All right. So remember
Cardiac notch, left ventricle.
left ventricle. That's right. Let me go to second page and pick someone. Ubaid Inamdar.
Yes, sir.
Yeah. Where is right ventricle in this X-ray?
At the right side.
On the right side? Okay. On the right side. All right. Keep yourself unmuted, right? Sakshi Gupta. Is he right or he wrong? Right or wrong?
I think he's wrong, sir.
Okay, why so? So if he's wrong, then you have to say two things. Where is right ventricle? And if he's wrong, then this is formed by what? फटाफट फटाफट चलो.
Sorry, sir. I don't know exactly.
Okay. Sachin.
सर
बोलो फटाफट. सेम क्वेश्चन.
सर क्वेश्चन क्या था?
क्वेश्चन क्या था? गुड मॉर्निंग पहले तो.
गुड मॉर्निंग.
हाँ. मतलब वेयर आर यू? एरो है. दैट इज फॉर्म बाय व्हाट? विच चेंबर? प्रीता. यार आंसर फटाफट दो.
Sir, can I?
नो, बिकॉज
Sir,
आई नो दैट यू आर नोइंग.
can I?
इसीलिए तो दैट्स व्हाई आई एम. बिकॉज सी ऑल दोज हु आर स्पीकिंग दे आर ऑन फर्स्ट पेज. नाउ आई मूव्ड द एंटायर थिंग टू सेकंड एंड थर्ड पेज नाउ, सो दैट आई नो दैट बाकी के लोग क्या कर रहे हैं. यार ये तो डिप्रेशन आएगा मुझे इफ यू आंसर. प्रेमिला रेड्डी, अनम्यूट. यार फटाफट करो ना. दिस वे तो इट इज डिफिकल्ट टू टीच. ऐसा नहीं चलता. वेदर यू नो इट और नॉट, यू जस्ट डोंट हैव टू वरी. दिस इज होम पेज. करो ना, गलतियां करो. सो इफ यू मेक अ मिस्टेक यू विल ऑलवेज रिमेंबर, करे बॉस मैंने ऐसी गलती की. एग्जाम में गलती नहीं करोगे. एल्स व्हाट हैपेंस कि नाउ आई नो देर आर ओनली 10 to 12 पीपल हु आर ईमेलिंग रेगुलरली. 10-12 लोग हैं, राइट? और वही 10-12 लोग बोलते भी हैं. बाकी रेस्ट ऑफ यू आर साइलेंट. तो वो क्या होता है? इट इज लाइक अ पैसिव लर्निंग. पैसिव लर्निंग में यू कैन नेवर लर्न. कभी नहीं आता, भूल जाते हैं. कम से कम यार इतनी तो इज्जत दो. प्रेमिला, एटलीस्ट अनम्यूट योरसेल्फ. कम ऑन. तृप्ति जादव. अरे बॉस, you don't even unmute yourself. Now how to teach? This is like my wish was कि this session will be एकदम मारफाड़.
Hello, sir.
हाँ यस अथर्व.
Can I tell it?
नहीं
Means
मुझे
I am
पता है, यू
guessing
नो
it
इट. नहीं
actually.
जो जिनको मुझे
No,
ऐसे
sir.
हाँ.
I am. This is my first lecture, sir.
योर फर्स्ट लेक्चर. अच्छा तो चलो, दैट इज गुड. एटलीस्ट वेलकम.
I guess, sir, it is a.
हाँ बोलो. यस, गो अहेड. यू आर अलाउड टू गेस. सो बोलो.
Right atrium, sir.
बॉस यू आर 100% राइट. दिस इज राइट एट्रियम. This is this is left ventricle. Where is right ventricle? Right ventricle is in front. So right ventricle cannot be seen. Right ventricle cannot be seen into X-ray chest PA view. इसके देखने के लिए you have to watch the lateral view, right? So that's why है यहाँ पे right ventricle, but we cannot see because this is X-rays. They are the 2D presentation.
Sir,
This
the
is
reason
shocking.
behind it is because the heart is tilted and rotated at an
Very
angle.
right. Very right. Exactly. But यार this is shocking. आप what are you doing यार? Unmute भी नहीं करते.
Sir, and how?
The thing you told, like make a heart
मुझे
with
बहुत
your
अच्छा
heart.
नहीं लगा. I didn't feel good. हमें तो कुछ नहीं आता था. वो सर ने बोला स्टैंड अप. अरे बिंदास. सर बोलते थे गैस मार, तो गैस मारते थे. गलत होते थे तो सर डांटते भी थे, गधा भी कहते थे कि क्या करेगा. बट देन इट यूज टू पिंच, इट यूज टू हर्ट. तो पर फिर जिंदगी में कभी नहीं भूलते थे. प्रतीक्षा जोलाद. Just unmute. I can ask, I'll be asking very simple questions. At least unmute yourself. Talk to me. Okay.
Sir, I have a question.
Ashraf, chalo.
Sir, how left atrium will be seen?
Sorry, question again.
Left atrium,
Huh?
where it will be?
Left atrium is those behind, right? So if we draw it like this is like a top view,
Lateral view.
right? Lateral view. Exactly. Left atrium will be seen in lateral view because see, left atrium is behind, right ventricle is in front. This is the right atrium. This is the left ventricle. So this is our right border. This is our left border. But when we have to see these two chambers, you have to watch from the lateral side. But this is the thing. When I'll show you one X-ray, it is so amazing, right? But if you interact, then this would be fun. मतलब in my class there should be बिल्कुल शोर होना चाहिए. जब ऐसे शरीफों की तरह चुपचाप चुपचाप बैठे मत रहो यार. You are allowed to shout, speak. Sanaya. अरे कम से कम अनम्यूट तो करो. Now I'll ask
Sir, they
random.
are AFK, I think.
पता नहीं. This is surprising. Yashika. I'll take the name one. अरे even गलती हो तो भी क्या फर्क पड़ता है? कुंजल.
Yes, sir.
हाँ. Okay. What is hilum?
Can you repeat, sir?
What is hilum?
The cut on the vessels, blood vessels.
This is the lung and the entry from where the
Yes.
bronchus, right? This is the trachea. Trachea will divide into primary bronchus. So this area is called as the hilum. ठीक है? Okay. चलो कुंजल, ऑनलाइन ही रहना.
Yes, sir.
Is there plural effusion? Right? Because I know, many times I get your emails. So you pay good attention. Is this patient having pleural effusion? Pleural effusion. Pleural effusion is what? Pleural effusion is collection of fluid into the pleural space.
Basically a whitish X-ray. It should be.
Is it there? Yes or no? हाँ कि ना? बस.
No.
Reason बाद में. हाँ कि ना?
No.
No. Okay, चलो. You say no. Simran Pandey. Effusion है या नहीं है? Yes or no? I'll take the name only once. If you don't unmute, then I'll move on to the next person. But do take part here. Nisha Dalvi.
No, sir.
Okay. Yes, you all are right. There is no pleural effusion. Reason behind it is you have to look for this space. Which angle is it, Nisha? This angle is called as what? What is the name of this angle?
Sir, may I? Sir, may I?
Sir, may I?
Sir, may I?
I know,
Sir,
I
may
know. निशा पहले तुम बोलो. इसका नाम क्या है इस एंगल का? दो ही तो एंगल थे. वन वॉज दिस. एक एंगल ये है. दिस इज वन एंड दिस वन इज टू. कैसे खत्म करेंगे इतने सारे एक्सरेज? साक्षी पवार. वन इज
Sir.
व्हाट, टू इज व्हाट? हाँ बोलो.
Cardiophrenic angle and costophrenic angle.
शाबाश. Right? This is cardio, means heart. Phrenic is diaphragm, and costo is the ribs. So we have got the cardiophrenic angle and the costophrenic angle. This is called as the costophrenic angle. What happens when there is fluid into this angle? what is called as the pleural effusion. This angle is, what is the word?
Obliterated.
Not visible.
Obliterated. Very good. It is this angle is obliterated, right? Or you can use the word obscured, right? Obscured. ये दोनों का meaning same है. Many times you'll be getting the words obliterated or obscured. That means that angle is not seen. This angle would be looking like this. मतलब यहाँ पे white हो जाएगा, fluid. So that fluid is pleural effusion, and you'll see several X-rays with the reason, right? But why I'm bit, सही बोलूं, मुझे बहुत अच्छा नहीं लग रहा. My dream was like कि आज तो everyone will be talking. Still, I'll not lose hope. Okay, so this is a normal X-ray. And in this normal X-ray, we studied certain things. For the practice, this is same X-ray. I'm just writing the number. How obviously, right? This is it a female X-ray? Hi, these are the breast shadows. Right? So this is a female. On to the next one. Here
So,
is. Huh?
so can you tell once how to write a radiological report, as you said, for the first
Report.
text?
Huh. Say for this, the pattern will always be same. So first, when you look all the corners. Look all the corners. This is the beginning of watching any of the X-ray. First, look at all the corners. So you will watch it over here. The marker is correct or not, right? कई बार अगर जो marker ऐसा आया, ऐसा, तो you know that आपने X-ray उल्टा लगाया है, right? Or if the R is written like this, so that means कि X-ray is उल्टा. Just take it out and उसको सीधा करो. हाँ. So you'll write the report like this. That this is the
Sir,
X-ray. हाँ.
in all the X-rays it will be there, right? That R and L.
हाँ, either there'll be R over here or there will be L over here, because these are the lead markers. Lead, right?
Yes, sir.
They are made up of lead. Now, lead is like a metal through which the X-rays cannot pass. So that's why these markers, they'll be seen very prominently. In some of the cases, you'll be watching the PA. पर अब कोई PA नहीं लिखता. But yes, if it is AP view, तो then it would be mentioned AP view, right? We discussed what is the difference between PA and AP view, because AP view is something which is taken only in case of emergency, when the patient is unable to even stand, right? So
Yes, sir.
that, and you'll watch such X-rays, right? And you'll see the marked difference. At the same time, because I want that you guys speak, jitna bologe, right? You'll make mistakes, but that is what I want. Don't worry about it. Anyway, the normal X-ray, it is written always like that. This is the X-ray chest of a female, right? And यहाँ पे नाम लिखा होगा, एज लिखी होगी. So that first you'll comment on the lung fields. Lung fields. So in this, lung fields are clear. And most important thing, what you'll watch is upper lung fields, right? They are less prominent as compared to the lower lung fields, which is normal, right? One important finding. I'll step by step, I'll keep on adding points. So first, right, understand this. Upper lung fields, less prominent as compared to lower lung fields, right? This is the observation which you will be doing every time. So this is clear, right? Clearly दिखता है ना, right? If you divide, this is upper, this is lower. Lower is definitely more powerful because the gravity, because of the gravity, the blood will be going over there. So there'll be more air over here and less blood. Air is here also, but there is air with more blood because the gravity, blood is getting pulled by the gravity. So this is what really happens. It is not so that ऊपर जो है, there is no blood. There is, but relatively. That's why this is a relative comparison, and it is one of the very important comparison of a condition, what is called as the pulmonary edema. और pulmonary edema, it is such a simple thing. अगर जो दिमाग में घुस गया तो just in next half an hour you will start diagnosis amazing things. But दोस्त सबको बोल रहा हूँ, बोलो, बात करो, talk. I'll take the
Sir,
chances. हाँ,
sir, if the patient is lying on the back, then there would be a difference in the upper lung field and the
and
lower lung field.
there would be a difference. That's what when you, because see, patient will be lying on his or her back cup when the patient is unwell, patient is unable to stand, right? So in that case, we don't go for PA view. Which view we go for? AP view.
AP view.
AP view, right? So हाँ, वो जब आएगा एक सेकंड में आपको पता चल जाएगा कि हाँ, this is right. So first thing you'll comment on the lung fields. So this is your first statement. The second statement would be, is the heart enlarged or not? Enlargement of weight. Uh, wait. Pranjal Nayak. Pranjal Nayak. यार अनम्यूट तो करो. You don't even unmute.
Yes,
हाँ,
sir.
चलो गुड, शाबाश. दोस्त, हार्ट एनलार्ज्ड हो तो उसके लिए वर्ड क्या है? व्हाट इज द वर्ड वी यूज इफ द हार्ट इज एनलार्ज्ड? ऐसा नहीं लिखते ना कि हार्ट इज एनलार्ज्ड, वी राइट समथिंग. देयर इज एक वर्ड, वन वर्ड. व्हाट इज दैट? बड़ा बड़ा सा वर्ड है, मेगा वर्ड है.
Cardiomegaly.
कार्डियोमेगाली.
Sir, may I?
Can I?
हाँ, कार्डियोमेगाली, राइट? कार्डियोमेगाली. रुचिका, अनम्यूट. फटाफट जैसे बोली इमीडिएटली अनम्यूट.
Yes, sir.
हाँ, शाबाश. व्हाट इज लिवरोमेगाली? ऐसा है कुछ, लिवरोमेगाली?
Yes, sorry, sir, I don't know.
हाँ, पर लिवर को क्या बोलते हैं?
Hepato.
हेपैटिक.
Hepato.
So that is हेपेटोमेगाली. हेपेटोमेगाली.
Hepatomegaly.
हाँ, ठीक है. बट नाउ यू विल ऑलवेज रिमेंबर, राइट? अभी नहीं आया उसका कोई प्रॉब्लम नहीं, बट वंस बिकॉज इट वाज आस्क्ड टू यू, यू विल ऑलवेज रिमेंबर इट. ध्रुव मात्रे.
Yes, sir.
ध्रुव मात्रे. अरे ध्रुव, अनम्यूट यार.
Sir, I am traveling, so I
यार तो
cannot
क्या हुआ,
take it.
ट्रैवलिंग तो सुनाई तो देता है ना. अच्छा, एक पेशेंट है, उसका लिवर भी एनलार्ज्ड है, स्प्लीन भी एनलार्ज्ड है. व्हाट इज वन वर्ड? दोनों का एक एक वर्ड में ही लिखना है तो.
Sir, may
Sir,
I?
can I try?
Sir,
हाँ,
may I?
बोलो बोलो.
Sir, hepatospleno something. Megaly, maybe.
मिगाली. हाँ, मिगाली तो कॉमन है ना. सो इट इज
Hepatosplenic megaly.
hepatosplenomegaly.
Hepatosplenomegaly.
Correct. Right? It is like hepatosplenomegaly. That's
Splenomegaly.
right. Simple. It happens in malaria. Right? So hepatosplenomegaly. चलो, ये जो है ना, देखिए एग्जाम जैसा ही हो गया है. जानवी, अनम्यूट. मैं अनम्यूट कर देता हूँ. So Janvi, now you are unmuted. Okay.
Yes, sir.
हाँ, in clinics we say just complete these 4 steps. I'll be giving you only the first step. Inspection. What is that? Second, third, fourth. Inspection is watching. Touching is what?
Sir, can you explain it once more?
What?
Sir, can I?
These are the clinical steps to examine the patient. First is inspection.
Okay.
Fourth was auscultation. In between क्या थे?
Um,
कोई बात नहीं, ये ध्यान रखो.
sorry, sir.
नफीस शेख.
Sir,
नहीं
may
नहीं,
I?
कोई डोंट बी सॉरी.
Can I tell?
Sir, may I?
नहीं
Sir, may I?
Sir, may I?
Sir, may I?
नहीं, मुझे
Sir,
पूछने दो रैंडमली. लेट मी आस्क. सयाली पवार. मैंने वैसे अभी किसी और से पूछा था, पर नो प्रॉब्लम. सयाली पवार, फटाफट. दिस सेकंड इज व्हाट? इंस्पेक्शन. प्रांजल, फटाफट. Bhumi Kurale.
Sir, may I?
Sir, may I?
Yes,
Sir,
sir, may
Sir,
I?
may I?
Sir, may
Bolo.
I?
Bolo.
Palpation,
Palpation and
Inspection and
Palpation,
percussion.
percussion.
percussion,
Percussion.
Inspection,
Palpation.
palpation,
Palpation. Percussion.
percussion,
Percussion.
percussion,
auscultation,
and
Auscultation.
auscultation. Auscultation का
Oscillation.
मतलब क्या? What is auscultation?
Sir, can
By
you just
stethoscope.
Ear.
Here with the
Stethoscope.
stethoscope.
Stethoscope
Patient.
say.
Someone was asking anything.
Sir, what was percussion?
Percussion was this tapping. Because when you tap, if there is fluid inside, so then there'll be a different note. When it is air, it will be a different note.
Oh, okay. Thank you, sir.
Right? Chalo, ठीक है. So you'll be commenting first on the lung fields, and then you'll be talking about the size of the heart, right? Whether the heart size is normal or not. So heart size. This would be the second point. The third point, you'll be commenting on the costophrenic angle. Costophrenic angle. So here you'll say that both the costophrenic angles are clear, thus it is not suggesting of any collection of fluid or the pleural effusion. Okay, just this much. Ribs are normal. Because next question which is about to come is,
Excuse me, sir, I had a doubt. If there are like small effusions, तो वो तो normal state PA X-ray chest पे तो नहीं दिखेंगे, तो उन्हें कैसे देखते हैं?
say when the fluid gets collected, that fluid is pretty massive, quite more. Right. But in order to obscure this angle, there has to be the collection of at least 50 ml of fluid. When the fluid level is less than 50, you need to go for certain special procedure where you have to shift the patient on one side and then you have to take the X-ray. It's a special procedure. Or you have to see it with the help of ultrasound. But one thing is, when the fluid collection is less than 50 ml, it won't be causing much of the sign symptoms. Right? So usually patient आपके पास आएगा ही नहीं. Patient won't come to you. Because if patient has got normal coughing, so he won't come to you and say, you usually encounter it when someone comes for physical fitness and then you suspect that there is only a very narrow, very less obliteration of that angle. So that is when you suspect such patient and then you go for it. You ask for the history. Are you smoking? If it tells, yes, smokes 10 cigarettes a day, right? And then when you do some auscultation, you find that yes, there are rails. So in that case, you might have to go for that procedure. But otherwise, नहीं. Right? अभी दिखता है तो एकदम clearly. You'll see that.
Sure.
हाँ.
In the X-ray which we just did, like I noticed on the right hand side, the clavicle is not clearly connected.
I mean, this one?
Yeah, this one. Like if you see on the left hand side, it is kind of connected very clearly, but here it's not. I mean,
Here,
maybe it's because
see.
of the light which is seen. I'm not even.
See, otherwise, if you watch, this is the outline of the sternum. Outline of the sternum. Here it is connected, right? But because it is the shadows are overlapping. Shadows are overlapping, that's why we are unable to appreciate that. Otherwise, it is connected.
Sternum is present in the middle, so on both hand side it would have the equal amount of areas which it would be covering, right?
This is sternum, right? This is manubrium, and the clavicles, they are connected like this. So, but if there is slight rotation, then this particular shadow, it goes like this, right? So we might feel that, okay, there is some gap. Actually, there is no gap.
So, but then when there is an actual gap, then how would we understand it? Like
Actual
again,
what?
like there would be an actual gap between clavicle
There
and
is
the
never a
sternum.
gap. There would never be a gap.
Okay.
It is always connected to the sternum, manubrium. Right? It is always there. And if it is not, then it would be broken because it is not. So in anatomy, we'll see that it is over here, there are so many other structures which are connected. In fact, a very major muscle, the pectoralis major, which is forming the complete power for the chest and the arms. So that is connected over there. So it is never so that they are isolated.
Okay,
In case of this, any cleidocranial dysostosis, So in that case, this particular bone will be so thin, it will be poorly developed, right? So that also you can make out very easily. So this looks like a healthy, good, proper clavicle.
Excuse me, sir.
Yeah.
So can you explain the first point again about the lung phase? My actually connection is very weak.
Which one?
The first point.
Lung fields, this one?
Yes.
See, you can appreciate, divide the lungs. This is the entire lung. Divide it into two parts. This is looking more black.
Yes.
So that means here there is more air.
Okay.
This is looking bit white, right? Because there is blood as compared to above, right? But there is air also. So because we can see this black and white. So these are called as the vascular markings. So vascular markings, they are more prominent in the lower region as compared to the upper region. Air
Okay,
travels
sir.
up and fluid travels down.
Okay. Thank you, sir.
On to the second one. Now watch
Sir,
it. हाँ बोलो बोलो फटाफट.
sir, in the first X-ray, how can we get to know that there is cardiomegaly or hepatosplenomegaly?
No, hepatosplenomegaly we just can't see. It was just for the sake of terminology, right? For the cardiomegaly, right? A good question. You just take this length. This is called as the cardiac length, and then all the way from one side of the rib to another side. That is the thoracic width. So this is what is called as the cardiac width, right? And this one is called as the thoracic width. Thoracic width. Cardiac width should not be more than 50% of the thoracic width. So cardiac width should not be more than 50% of thoracic width. Right? Visually, you just watch it, you know that yes, this area is way smaller than half of this entire big area. If I say this is B and this is A, so then B is definitely less than half of A, right? It is definitely less than half of A. Right? So that means heart is normal. Right? We'll see the cardiomegaly. We'll see that. Watch now. Now this is very tricky, right? This is very tricky. In fact, this is just to make you understand that it is not so, are heart is enlarged. Nine. This area is focused because I want you to see this area. This area, it's not as white as this above area. It means heart is not going all the way up to this point, right? And then when you look at it some distance, you'll find that yes, this is the heart. This is the heart. Heart is fine. This area is posing some shadow. This is what is called as the pericardial. This is a very typical X-ray. It is called as the pericardial fat. Pericardium is what? Pericardium is that layer which is covering the heart, right? Had it been, because we'll see that thing in cardiomegaly, the heart, this white shadow will go all the way down, because heart tissue is there, right? But over here, heart tissue is not there, right? So that's why it is looking bit blackish. Blackish kyo? Lungs are there. So that's why it is imposing this. So this is extra shadow because of the pericardial fat. Very typical case. Very typical. So many.
So here heart is not present, but its layer is present.
Air is present, and that's why this fat is getting accumulated into that pericardium. There
Okay.
was lecture, definitely Manthan, there was a lecture. We keep the lecture even on the day of Diwali. So lectures will always be there. हाँ बाल पे अच्छा काफी लोगों ने आंसर दिया भी था ईमेल में ईमेल क्या मैसेजेस में.
Sir,
हाँ
sir, I had a doubt. Could you please scroll up?
अब फर्स्ट एक्सरे पे नहीं जाएंगे, फटाफट पूछो व्हाट्स द डाउट.
Actually, there was a scattering of white light on the lower lobe of uh, lip
वेयर इज
lung.
स्कैटरिंग? बिकॉज पहली बात देयर इज स्कैटरिंग ऑफ, अच्छा कुंजन ना
Yes.
कहाँ है स्कैटरिंग ऑफ व्हाइट लाइट? पहली बात तो ऐसा कहीं स्कैटरिंग होता ही नहीं, बिकॉज वी डोंट यूज लाइट.
I
कहाँ
just
है?
feel like
कहाँ
on
पे?
the ribs.
मतलब आर यू टॉकिंग अबाउट दिस एरिया?
No, no, sir. Through the ribs.
वेयर?
So could you please scroll up? You have circled the lower lobe right there.
मतलब यहाँ
The
पे?
above X-ray, sir.
दिस इज द फर्स्ट एक्सरे. अच्छा यहाँ पे. हाँ.
Yes, sir. That one.
तो दिस एंड दिस, राइट, ये दोनों एक ही तो है. दिस एक्सरे एंड दिस एक्सरे, दे बोथ आर सेम. ये तो
So I'll
नॉर्मल एक्सरे.
screenshot and mail you the highlighting the point.
मीन्स विच एरिया यू आर टॉकिंग अबाउट? इज इट दिस?
No, sir. A bit right.
Bit right means this is right.
No, sir. My right. That means left.
So you are talking about this
Yes, sir. That area.
hilum. It is
Oh,
hilum. These are the hilum. This is the hilar region. Hilum. Hilum is what? Hilum is that entry where
entry.
everyone enters. Right? Pulmonary artery branch, pulmonary vein tributary, and this primary bronchus. Everyone is entering. So that's why it is so prominent. वही तो बोला. पहला ही क्वेश्चन था. This area is hilum. This area is hilum. And if you say this is prominent, so it is prominent even on the opposite side also. Both the sides. See, this is prominent. This is prominent. That is what is
Yes,
called
sir.
as the hilar region. Hilum. Okay. So this is pericardial fat, right? Quickly we move. So this is for your practice. On to this third X-ray. Now see. Comments.
Sir, this
Sudarshan
should be
Jadhav.
cardiomegaly, I guess.
Sudarshan.
Cardiomegaly.
Sir, this is cardio.
This is
Cardiomegaly.
Cardiomegaly, sir.
Cardiomegaly.
Schizophrenic angle
Should not
Cardiomegaly
be
is not visible.
distorted.
Cardiomegaly.
Cardiomegaly.
very good.
Heart.
No doubt about it. Right?
And costophrenic angle is not visible.
Though it's not much, but yes, there is, at least you can surely say that this is cardiomegaly, right? That is sure. Angle, when it is seen like this, right? I'll show you what is obliterated angle. If you can see this angle, then there is no effusion. By the way, let me ask randomly, Sanika, ये क्या है? What is this? जिनको आंसर पता है, they can message. They can message, right? Just message. So I'll read that. It's open. True. True. SSRRTT. आयान, यार अनम्यूट करके कुछ तो बोलो. उन्नति.
Sir, I have put the answer. If it is correct.
It is correct. This is stomach gas or the gastric gas or the gas bubble.
Gastric bubble.
Gastric bubble. सही बोलूं? I'm not enjoying. First time I'm telling you. I feel like एक बार अगर जो बोला कि अनम्यूट करो तो यार गलत जवाब हो तो भी क्या फर्क पड़ता है? कौन सा केबीसी खेल रहे हैं? गलत जवाब और गेम से बाहर.
Sir, I have a doubt. In the previous slide, sir, you said that during cardiomegaly, the whole portion should appear a deep white, but still the cardiophrenic angle is slightly different than the heart veins, slightly lighter.
Where is it? Which cardiophrenic angle you are talking? Where is it light?
So the
Look
portion
at,
is
see, look at this. This entire thing, right? And it is going like this. And see the difference over here. This is crisp, clean. Matlab, you find it blackish. What? Watch for this. Where is it? There is no black area. So definitely this is not pericardial fat. Compare this area with this. Instantly you'll find, yeah, this is so blackish. You have to just compare this with this, right?
okay, sir.
And see over here.
Okay.
चलो इसके लिए
Sir,
राशि राशि अनम्यूट कर सकते हैं ना आप लोग, because I'm taking so many names and no one is even caring to unmute themselves.
Sir,
Hmm.
I have a doubt in this X-ray.
फटाफट बोल दो.
Sir, does gastric gas cause any symptom in the X-ray?
See,
Does
symptoms
it
are
have
with
any
the
background?
patient, right? So if there is more gastric gas, so then patient will be uncomfortable. X-ray won't be uncomfortable. X-ray तो ठीक होगा.
Yes, sir. I wanted to ask the same thing.
Because in my entire life, X-ray has never spoken to me that I am uncomfortable. Symptom तो दोस्त patient को होगा ना. But yeah, when we'll take the X-ray abdomen, at that point, I'll show you that what is called as the gaseous distension, when you will be watching multiple layers of the gas. Right?
sir,
हाँ बोलो.
sir, I had a doubt in previous slide.
क्या बोलो?
Sir, isn't this a case of mitral stenosis as the border is quite no sir this yes, as the border is quite straight.
हाँ, but the border is, this is the correct border.
Okay.
We'll see the mitral stenosis. Definitely. But
Okay.
yes, it is fine. It is fine. Yes, you can. चलो इसके लिए तो बोलो. This is like clearly, right? Take this distance and then take this distance. This is, let's say, B, this is A, and this B is definitely more than A by 2, half of that. And that's why we say that this is the
Cardiomegaly.
Cardiomegaly.
And by the way,
Cardiomegaly.
pericardial fat जो है ना, it is very rarely it is seen. That is a pretty rare X-ray. ज़्यादा नहीं मिलता देखने. So this is a known case. But over here, even see this lung fields are normal, right? So the upper is more black as compared to lower, right? So this is also clear. Or this trachea, that is in absolute center. So everything is fine, right? And see in this case, the spine is here and here. So this is the perfect, very good alignment, right? X-ray was taken very properly. So between the two ends of the clavicle, spine is exactly into the middle. देखा कैसे कि spine middle में है? Watch this. These are the spines, right? This is the and this is the spine, right? So that is seen. These prominences. They are exactly into the center. So very nicely taken X-ray, properly centered. Right? We have got this. हाँ, ये normal study के लिए इस पे लिख लिया. चलो, so this is fourth. Let's watch this fifth. अब शुरू हो रहे हैं big games.
Sir, why it is called like that? Cardiomegalic.
Heart is enlarged because of various reasons, right? That is what we'll learn in cardiology. But बड़ी simple सी चीजें आपको बताता हूँ. Watch this. This is, which chamber is this?
Left
atrium.
Left atrium.
Left atrium.
Left atrium. So this is left ventricle.
Left ventricle.
यहाँ की, this is what? This is
mitral.
mitral
Bicuspid valve.
Mitral wall.
Bilateral valve.
mitral valve. It is bicuspid. Now, if this valve is not opening properly, that means there is mitral stenosis.
Yes.
Who has to work more, left atrium or left ventricle?
Left
Left atrium.
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 Right? So left atrium has to
Ventricle.
push the blood every time. It has to push it into the left ventricle. So there would be enlargement. So when we say in general that, okay, cardiomegaly, to be very specific, there are sign symptoms which will tell that which chamber is enlarged. It is not only that cardiomegaly bol diya. The next question should come up is which chamber? It is not so that entire heart. That also happens, but in only some very few cases. Otherwise, there is always enlargement of a specific chamber. Right? But in general, we say that heart is enlarged. Then we'll be diving deep into it, that what is enlarged, what has already been occurring to it, right? Okay, so good. So over here, right? Now, heart enlarged, so there is cardio.
Cardiomegaly.
Chalo.
Cardio.
This is the first observation we granted. What else can you see in this? Can you see anything
Pleural
else?
effusion.
Sir, lung
Dysphagia.
fields are abnormal
Pleural effusion.
Okay. Do you
and
really
lung
see?
fields are not
The
normal.
the trachea is bent
Trachea is
bent
Leads to
along the
Bent.
dysphagia.
spine.
right. Trachea is shifted on one side.
Yes.
So when the trachea is shifted on one side,
Sir, I think
any comment on that?
There
SOL.
can be
Sir, is there
SOL.
an issue in the
SOL.
hilum?
Yeah, SOL.
Hmm?
Sir, is
There
there
can
issue?
be
Is there
SOL.
an issue in the hilum?
Over
Or
here, over here, it is because of the enlargement, right? Because of the enlargement, this has been shifted. Okay, we'll have, but यहाँ के लिए अभी इतना रखो कि there is cardiomegaly, right? We'll come back to this X-ray. Watch this so that now you start getting more better idea. You'll start watching more. This is what number 5. हाँ, चलो, we'll start watching more. So many things to see in this. देखो,
There is a hole, sir.
कहाँ पे?
On the left lung.
Left,
Is this
not
the
lung.
hole?
Yes, think so.
It is metal. This is metal. क्योंकि अगर जो hole होता, so then what happens? That means there is no
Should be
tissue. There is no tissue, so this area would
blackish.
be black. यहाँ पे gastric gas कितनी सारी है? So this is black. So this is like a metal. So one hint, this is a metal. Metal ring. ऐसी ring कहाँ से पहुंच गई यहाँ पे? This is artificial valve. This is metallic mitral valve.
Sir, prosthetic?
Prosthetic valve. Very good. It is called as this is another name. It is called as the prosthetic valve. Very good. शाबाश. So if it is valve, तो that means valve डालने के लिए तो heart खोलना ही पड़ेगा ना? Correct?
Yes.
Yes, sir.
So the moment you see this that there is artificial valve, तो valve डाला क्यों? Are you getting any
Due to
hint?
the
Stenosis.
cardiomegaly.
नहीं, because of valve, the heart must be failing, ना?
Yeah.
इतना. So
Yes.
what is this? इतना बड़ा, इतना huge. This is massive, massive. Very rarely it is seen. This is massive left atrial enlargement. Now, left atrium has got two parts. One is the left atrium itself, and then the second is left atrial appendage. Appendage is its extension. This is enlarged left atrial appendage. Right? So that's why it is so much enlarged that you get the double border. This is a very typical thing. Can you see? This is like one border, and this is like a second border of the heart. This is what is called as the double border
Yes.
sign. Right? Double border. Very rarely it occurs. Double cardiac border. Huh? Double cardiac border. This is massive left atrial enlargement. Massive. Can we say this is just post surgery? Surgery हुई उसके बाद ये एक्सरे लिया हुआ है. Can we say that? Yeah, we say this X-ray is before surgery, post surgery.
Post.
क्यों? क्यों?
Surgery.
Wall is present.
What are these? This. ये क्या है? All the way यहाँ पे है, यहाँ पे है.
Like wire.
Wires. दिख रहा है. It is like a wire. So that means these are metallic suture. Right? They are metallic suture. ये suture क्यों लिए? Because when for open cardiac surgery, the sternum has to cut. Sternum यहाँ से काटा, and with retractors the whole chest is open like Hanumanji, and then everything is performed.
Sir,
After that, the chest is put back, and those metal sutures they are taken. These are all metal sutures. हाँ बोलो.
sir, is it like sternotomy or something?
Sternotomy. Exactly. Sternotomy. Right? So this is how these metallic sutures they are taken. This is old age female, right? This we can say from the shape of the breast.
Sir,
Huh?
here mainly only the left atria is enlarged, right?
Correct.
That is the main thing which we are supposed to remember.
Yes, yes.
Oh.
And all those rest of the things, they are as a supportive evidence.
Okay, sir.
This is for the practice. Right. So many things to see. देखो.
No gas. Gas.
What do you find in this?
Is he lying on the chest, sir?
The trachea is little bit pushed due to presence of SOL.
SOL नहीं है. There is no SOL. कहाँ पे है SOL?
Fibrosis, sir. No?
See.
Yeah, then it can be fibrosis. Sir.
Say grossly if you see.
Sir,
So can we say that यहाँ पे heart is enlarged?
sir, lower
Yes.
zone are more
Yes, sir.
affected.
So let's take it one by one. Cardiomegaly. Right? Because immediately when we take this distance and this distance, we know that yes, heart is enlarged. एक second में we come to know. So there is cardiomegaly. Is at least this first point is clear to everyone? Cardiomegaly?
Yes, sir.
Yes, sir.
Yes.
Yes, sir.
For the lung fields, right now we don't comment. What was the third point which we used to discuss in X-ray chest reporting?
Angles.
The cardiophrenic angle.
Angles.
Any comment on that?
Costophrenic
The
angles.
angles
not
are not
clear.
visible.
Now
Phrenic.
this
They are
is
not
what
visible.
is
Angle
called
is
as
not
the
clear.
pleural effusion.
Pleural
See,
Incorrect.
नहीं तो अगर एंगल ऐसा होना चाहिए. This is called as obliterated. देखा? Absolutely rounded. पता ही चल जाए कि this is because of fluid. Because fluid takes this shape. This is classical bilateral pleural effusion.
Sir, in unilateral, is there only on one side the angle is absent?
Correct. When it is on one side, we'll say it unilateral, in which you have to mention whether it is on right side or left side. Right? But
The
over here,
consolidation.
but so this is clear. Now comes something which is new. Apparently, in this area, right? In this area, what are these things? All those bronchovascular prominences. So literally, you can see that yes, they are so prominent. They are seen. यहाँ ऊपर तक दिख रहे हैं. Right? See these markings. They are seen till this point. Normally इतने नहीं दिखते ना.
Yes, sir.
Right? So why should they be seen? Why should they be seen? It is because of the whenever there is
Fluid.
more fluid,
Fluid has
we
filled the
say
gap.
edema. We say it edema. ठीक है? Whenever there is more fluid, it is called as edema. Because it is in lungs, so we'll call it pulmonary edema. Easy. Pulmonary.
Yes, sir.
When
Sir,
there is
is lower zone is more affected?
Entire lung is affected because say lower zone to is there, but even the upper zone is also. How we say? From the prominences, bronchovascular, they are so prominent. They are so prominent. So this is the pulmonary edema. Now there are some very typical classical signs. One of the sign which we really see in this case is that very बड़े ध्यान से see pulmonary edema, it can be divided into two parts. Cardiogenic, that means when the fault is in the heart, or non-cardiogenic, when the fault is not in the heart. Fluid gets accumulated. Fluid कभी भी दूर दूर तक यहाँ तक नहीं जाता. Right? Fluid will be accumulating over here. But if I zoom this picture, you'll be watching one of the very classical thing. Can you see this, this, this? Well, these are the horizontal lines. Now I'll remove them. And now you see. Can you see that there are some
Yes, sir.
horizontal lines?
Yes, sir.
Yes,
Right?
sir.
Yes, sir.
When these horizontal lines, they give you a master stroke. These are called as the curly B lines. These horizontal lines, right? इसीलिए when you watch ध्यान से इस साइड पे नहीं है, right? पर यहाँ पे है. They are called as the curly B lines. Curly B lines. हाँ क्या? हाँ. Okay. See, when you see these curly B lines, right? Curly B lines, that is because there is accumulation. These are the septas, interlobar septa. Uske andar there is collection of fluid. So this is called as, whenever these lines are seen, that is called as the interstitial edema. Interstitial edema. Fluid collection. अभी से ये जानना इसलिए जरूरी बिकॉज कर्ली बी लाइंस तो अच्छे मिस कर देते हैं. But now you know that they are there, and I'll show you several examples. So immediately you'll come to know. Right? हाँ. Reasons we'll talk about. बहुत है. I mean, there is cardiac reason, there is non-cardiac reason. Even on high altitude, it can occur. Kidney failure, it can occur, right? Because when the albumin level drops, so fluid that oozes into this. So, but these are curly B lines. Curly A. There is like a curly A also. Curly A will appear over here horizontally. So when the curly A is there, they are called as the curly A lines. So curly A lines, when there is deep septa involvement. And there is curly C also, that is when A and B both are present. So they generate a long line, and that is called as the curly C. But anyway, right? So these are the septas, normally not seen because they are very thin. But now when the fluid is collected, so that's why they start showing up. So that's the basic principle of curly. Right.
Excuse me, sir.
Watch this. Watch this. What do you see?
Lateral view.
In this, what do you see? Because it is focused. Arey yaar, don't you
Right
see?
lung.
Arey, kitni sari curly lines?
Curly B lines.
Curly B lines. Lines से not one but multiple. उसके अंदर तो 2-3 ही थी. ये तो see this. Correct?
Interstitial edema.
Interstitial edema. So there are two types of edema now. We know that. Now see, this is curly B lines. Correct?
Yes.
curly
Yes,
B.
sir.
Now onwards you should never miss curly B lines. और एग्जाम में अगर जो आपने बोल दिया ना curly B lines, right? They'll salute you. ये पता हो, मतलब your eyes will watch only those things which you know. Right now when I am asking you questions, so जो बोल रहे हैं ना, trust me, जो लोग बोल रहे हैं कि yes it is this, yes it is this, अरे गलत हो गया तो भी कुछ नहीं, but they will always remember. So this is curly B sign, and when you say this is interstitial edema. Interstitial edema. Interstitial means what? This fluid is getting collected into the interlobar septum, right? And see over here. So that is interstitial edema. When it is over here, right? This is what is called as the airspace shadowing. So you will see over here. Over here. हाँ यहाँ देखो. Can you see this and this? And it is called as the bat wing appearance. Bat wing, bat, right? So this is what is called as the bat's wing appearance. And this bat wing appearance, it occurs in alveolar edema. Alveolar edema. So here also, when you see these prominence, right? देखने पे immediately you come to such a big area is prominent, right? Let's not draw into this. So there is such a big area. So this is alveolar edema. So that is where we see the airspace, and in medical name or the radiologically defined as airspace shadowing. These are the keywords which I am telling you. When we say that there is airspace shadowing along with curly B lines, which is indicative of alveolar edema associated with interstitial edema, right? Someone would be flat given if you say this answer in any of the viva. But yes, इस बार के question में there was curly B line. And people, लोगों ने क्या क्या लिखा हुआ है, normal भी लिख के आए हैं. This X-ray only, right? But these are curly B. Now you cannot miss it. Same image.
Sir.
हाँ.
Sir, how to identify curly B and A lines?
अभी क्या देखा?
Curly B lines देख. A कैसे होते हैं?
हाँ. ए तो ए इज अ रेयरिटी. ए मैंने बोला ना वो हाइलम में से आते हैं. ए इज वेरी रेयर, वेरी रेयर, बहुत मुश्किल. वो तो देयर आर हार्डली, आई शो यू सच एक्सरेज आल्सो, आई शो यू व्हेन, पर अभी नहीं, मतलब दोज रेयर थिंग्स तो उनको रेयरली रखते हैं. बट
yes sir.
इज ओके. ओवर हियर कमेंट्स, व्हाट डू यू सी? एक तो बैटविंग अपीयरेंस बोल दिया. एनीथिंग एल्स यू सी?
The metal rings.
So this is not cardiomegaly.
या पहले बोलो फिर बाद में लिखते हैं.
Is there any problem in the bronchi? The right bronchi. My right side bronchi.
I mean, you are telling this, right?
No, sir, the other one. It is slightly curved.
This one?
Yeah.
What to that is left, huh? This is not right. This is right and this is left.
Sir, my right actually.
No, never consider that. Your right or my right, no, ऐसा नहीं होता. When it is mentioned, right, this is right, so it is right.
Okay.
Otherwise, so everyone will keep on getting confused. Always remember, it is the with respect to the patient you are doing it. Otherwise, कई बार नहीं बोलते कि अरे वो राइट में प्रॉब्लम था, लेफ्ट में ऑपरेट हो गया. ये मेरा राइट और आपका राइट, नो, इट इज नॉट कंसिडर्ड. पेशेंट, यू आर वाचिंग पेशेंट. If patient tells कि मुझे यहाँ पे दर्द हो रहा है,
Costophrenic angles are not.
so this is
Pleural
normal.
effusion.
By the way,
Bifrontal
this angle is called as the angle of carina, right?
Sir,
This
it is
angle,
because it has to go below the aortic knuckle, right?
हाँ,
Between the aortic knuckle.
हाँ, it is called as angle of carina. चलो, so these are sutures. Metallic suture, so you have identified, right? The metallic sutures. क्यों किया है ये ऑपरेशन मेटेलिक suture? Do you see anything? कुछ और दिख रहा है?
Sir, what about the left bronchi?
is normal. Absolutely normal.
Okay, sir.
So
but
prominent regions of the
prominent hai.
left are
हाँ,
not visible properly.
which one?
Sir, if there
Prominent
pleural
regions,
effusion,
like we recognize things.
What is this?
Prosthetic wall.
Prosthetic valve.
Artificial wall.
That's right. This is prosthetic mitral valve. Correct. These are the metallic sutures. Then someone commented over here and here. What is that?
Orthophrenic angles are not prominent.
Postophrenic angles are not prominent.
Yes, they both are obscured or obliterated. So that means this is a case of
Pleural
Pleural
effusion.
bilateral.
Effusion.
Bilateral pleural effusion.
Yes, sir.
Correct. It is bilateral pleural effusion. All right.
Sir,
Huh?
right lungs should be little above now. Or both are looking equals almost.
It happens. It happens. Because there is so much of fluid. Right? So that's why they both are now studied, because this is like massive edema. Massive edema. So over here, when this bat wing appearance, it occurs now, when this is bat wing appearance. So this is basically what is called as the airspace shadowing. So when this comes, start watching. Do you see curly bee lines? Now there are few curly bee lines, right? But not very prominent. But there are few, right? This is one big one. It is in fact. So there are few curly bee lines. But this airspace, this shadow, this is very big, bat wing appearance. Right? So that's why this is alveolar airspace.
Alveolar edema.
So the alveolar edema. Patient is operated, right? And that is giving you these metallic sutures. This is a general look. Which number is this now? You lost the count.
9.
7th. Okay, this is 8th. Yep, this is 9th. This one is 10th.
Sir,
Huh?
sir, what is the difference between edema and effusion?
Edema is when the fluid, it goes into the interstitial space. So this is the airspace, this is the airspace, this is the airspace. Fluid goes inside, in between these. Right? Into the lung tissues. Say over here. In general, do you find that, see, airspace here and this entire thing? This is normal. This area is normal. But
Sir,
there is
something on
airspace
the
shadowing
right.
over here and here. I remove this. Now see, it looks like.
Yes.
Right? So this is pulmonary edema. Right? This is pulmonary edema.
We also observe the curly bee lines.
But this is unilateral. Right? And very good. Very good. Here are the curly bee lines. So now you can say that this is alveolar edema as well as interstitial edema. Pulmonary edema is a general term. Edema means collection of fluid. Fluid कहाँ पे collect हुआ? Fluid collect हुआ lungs के अंदर. Lungs के अंदर कहाँ पे? This is the air space. This is another air space. And in between fluid is going, so we are calling it interstitial fluid. Right? So that is what leads to this formation of these curly bee lines. Otherwise, ये जगह तो पहले भी थी, but it was so thin that we were unable to see that. But now you can see that. So this is what is called as the curly bee.
Sir, the trachea push.
Trachea is pushed. Trachea is pushed, but mostly the thing is even the patient is not straight. Right? See the spine.
Yes, yes, sir.
See the spine. Okay.
Sir, the right
Heart. What about the heart size?
broken.
What about the heart?
Cardiomegaly.
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 So that is granted. Cardiomegaly.
Sir, also pleural effusion.
Right pleural effusion.
That's right. Wonderful. There is right pleural effusion. Pleural effusion. Right-sided pleural effusion is more prominent as compared to the left side. Right? In left side, it is seen quite okay. But over here, it is definitely. So right-sided pleural effusion. Very good. Now I'll pinpoint. And now, do you see anything else?
Sir, is there pericardial fat?
Pericardial
Sir,
fats?
the right
Well,
bronchi is broken.
huh? This is this one? No,
Yeah.
no. It is not broken, right? It is just the overlapping of shadows because bronchi cannot break like that. But do you really see some round things over here?
Yes, yes.
So any
Yes.
idea what are they? Because see, it is here, it is here, it is here. What are they? ECG nodes, ECG,
Are they
ECG
floating
electrodes,
whips?
ECG electrodes. ECG के बटन होते हैं ना जिसके ऊपर वायर लगाते हैं, right?
Yes,
See, they
yes,
are,
sir.
these are the nodes. These are the ECG electrodes. All those.
There is one at left upper side. Right upper side, sir.
Right upper side. Right. So these are the. There is one very interesting thing. You can say that this is a old female from the soft tissue shadow. We can say, and over here, this is what is called as the aortic calcification. Aortic calcification. And you see, it is developing this bright light.
Yes.
Bright line.
Yes.
Yes.
So that is aortic calcification. So this is a case of pulmonary edema, but this is a unilateral because over here, the airspace shadowing along with curly B lines, they are seen more on the right side. In the left side, only the partial upper lobe is involved where the airspace shadowing is seen. Right side situation is more critical because curly B lines are seen, which is indicative of interstitial edema associated with right-sided pleural effusion as there is obliteration of right costophrenic angle. Ribs are normal. Right. Gastric bubble is normal. Okay. Comments on this. Something on this.
Cardiomegaly.
Nothing's normal.
Bilateral pleural effusion.
It is then.
It is in AP format.
हाँ पहला तो ये बोलो watch all corners. This is AP and that's why it is portable. हमने बात हुई थी पता है portable. Because patient
Yes,
is
yes.
so weak, तो
Yes,
patient
sir.
is unable
Yes.
to move. So that's why ऐसे patient लेटा हुआ है इसके नीचे प्लेट डाले and portable X-ray से ऊपर से X-ray डाल के प्लेट निकाल ले and then it is developed. Right? So this is AP portable. So that means patient is very sick. The patient is very, very sick. So that's why. So what do you see in this? क्या दिख रहा है? Lung fields की तो हालत ही खराब है. See this entire thing and this entire thing almost studded with fluid. So when you see less black, so that means it is airspace shadowing. When you see less black, so you can say in this case there is bilateral air space shadowing. Right? Shadowing. What else?
False cardiomegaly.
Can't stamp on it. Can't stamp on it. Right? It could be, it cannot be. Because see, whenever there is pulmonary edema, the pulmonary edema has got two causes. Cardiogenic cause, when there is left ventricular failure, so that can lead to pulmonary. Right? When there is mitral stenosis, there can be pulmonary edema. And in nephrotic syndrome, that is when the kidney is involved. Right? So then also it can lead to pulmonary edema. So that's why, because we don't have much of the history, so we won't be able to comment on it. So yes, we can say that it looks like that there is cardiomegaly. Whether it is true or false, always associate with the clinical sign symptoms. But yes, good. Right? By the way,
Sir,
Bilateral costophrenic angle obstruction.
Yes. True. Bolo.
Sir, why are the lungs looking small?
Because this is बच्चा.
Okay.
And ये क्या है जिसके ऊपर मैंने मार्क किया? What is that?
Hole.
ध्यान से देखो.
A tube.
Sir, is it aorta?
Aorta यहाँ आती है.
Sir, is it the trachea?
तो ट्रेकिया यहाँ पे आएगी. क्या बात करते हो? ट्रेकिया कहाँ है? ट्रेकिया यहाँ है. This is ट्रेकिया. और
Fluids. Okay, sir.
हाँ?
Okay.
और इतनी
Catheter.
परफेक्ट, एकदम परफेक्ट.
Fluid.
Fluid will take the horizontal level. ऐसा खड़ा ऐसे. हाँ?
Is that a tube?
It is a tube.
Catheter.
It can be catheter. It is a tube. It is a tube. और वो क्यों? क्योंकि जब इसको ऊपर ट्रेस किया तो ये यहाँ पे दिख ही रहा है ना. ये रहा, ये मास्क है. ये मास्क कितना बड़ा. So this is a mask and this one is oxygen tube.
Oxygen.
Okay.
Sir, bilateral lower consolidation.
It is there. Yes. It is there. But on right side, it is not very much, because if it is a lower lobe consolidation, then you won't be able to see this diaphragm. Diaphragm will be obscured because if the density after consolidation will be similarly as that of this density. So they both will look one. You won't be able to see the diaphragm. I'll show you more X-rays, but see the gastric bubble. So this is 11. Watch this. Aram se watch the whole thing first. Pehla, chalo, step by step. Is the heart enlarged?
No.
No, sir.
No, sir.
Normal heart. Now see, you will start thinking so logically. So normal heart. Heart is not enlarged. Do we see pulmonary edema?
Yes, sir.
100%.
Sir.
Because there is
shadows.
massive bat wing appearance on both the sides. Right? So pulmonary edema to 100% hai. Pulmonary edema.
So
Sir,
is it in old patient?
calcification
Now
is
pulmonary
also
edema, yes, there is calcification. Shabash,
Calcification.
you are picking up. So this is a old patient. Very true. Shabash. This is aortic calcification. Aortic calcification takes time, right? So that's when we are
Their
dealing with the
left
old
side
patient.
pleural effusion.
So step by step, step by step, step by step.
Kernel B lines.
Heart is
Curly B
normal,
lines.
Curly B
Curly B
lines.
lines.
Interstitial.
and they are
Sides.
seen on both the
Both
sides.
sides.
Both
Both
sides.
sides.
Yes, sir.
Both the sides. Proud of you. Shabash.
the
Curly.
diaphragm. Left diaphragm is
हाँ
also
एक मिनट
injured.
दोस्त एक मिनट रुको.
Bilateral interstitial edema.
So we say that this is pulmonary edema, right? So bilateral interstitial is confirmed, but airspace shadow भी तो है इतना बड़ा bat wing appearance, है ना? Right?
Yes.
Yes.
Yes, sir.
Sir.
Alveolar.
So
Alveolar.
we are dealing with
Edema.
Alveolar edema.
and heart is normal, so we can say the chances of non-cardiogenic pulmonary edema, correct? Non-cardiogenic.
Yes.
So your heart is normal because there is no chamber enlargement, कुछ नहीं है, बाकी सब everything is fine. So this must be the case. Commonest is when there is renal failure, right? Renal disease. And this renal disease, due to which all these things have occurred. So this is how you identify. In exam, you will be given very clear cut. Otherwise, in practice, as you will go, you will find many times picture would look like this, but then heart में से कुछ निकलता है. It becomes like cardiogenic pulmonary edema. So looking at this picture, you cannot just stamp it. But if the options are given, so you will be selecting the renal disease. Because at the graduation level, they won't be asking you so many complicated things. जो भी दिखेगा वो सीधा सीधा simple सामने clear cut दिखेगा. Right? So that is the curly B lines which are seen. So it tells that there is interstitial edema, there is airspace shadowing. So definitely there is pulmonary edema, and there is aortic calcification, which indicates that patient is of higher age. But the heart being normal, so that's why this goes more in favor of non-cardiogenic pulmonary edema.
Sir,
Hmm.
is there something wrong with the gastric person?
This area?
Yes, sir.
Yes. The diaphragm, right? Diaphragm is pretty loose. So chances of vagal nerve involvement is very high, and the possibility of the diaphragmatic palsy. So that's why the stomach, instead of going for that proper round shadow, it is looking like this. Possible. But before history, we cannot confirm it.
Sir, is there pericardial fat also?
Pericardial fat over here?
Yeah.
Possible. Possible. Good observation. Possible. Yes. Because this is the heart shadow. This is the heart shadow. Right? So this was the last X-ray. नहीं, अभी है और है. इसके बाद खत्म शायद. हाँ, है अभी है. या. अब तो बोलो, आप लोग ही बोलो. ये तो एकदम
Calcified aortic necrosis.
Bilateral pleural
Cardiomegaly.
effusion.
Effusion.
Cardiomegaly.
Cardiomegaly.
There is one by one लिखना शुरू करते हैं. ठीक है. One is heart is enlarged, so we say
Cardiomegaly.
megaly. Chalo, one done. First is done. Second point.
Bilateral pleural effusion.
Pleural effusion.
Bilateral pleural
Perfect.
effusion.
So bilateral pleural effusion. बिल्कुल correct. Third point.
Calcification.
कहाँ है calcification?
Sir, here it is not there because border is.
Here it is not there. Calcification तो नहीं दिख रहा. और कुछ. Anything else?
Obliterate costopenic angle.
Airspace shadowing.
Airspace shadow. Batman.
Airspace shadow. ये अब तक जब तक देखा था. See this hilum, right? See how prominently these are going up. जो normal X-ray था उसमें compare करना, right? When you compare it, you'll find that hilum ऐसा इतना prominent ऊपर कभी नहीं गया ना. See how prominent it is, this area and this area. Prominent this area and this area. So this is because of the edema, bilateral
fluid in the eye.
Yes. So that's why it is seen more clearly. So that's why we'll be stamping it as pulmonary edema.
Edema. So bilateral.
And obviously, yeah, bilateral pleural effusion, वो तो आपने बोल ही दिया. That you said. So here we can say that this upper zone, right? Upper zone is more prominent than lower zone. This is upper, and this one is lower zone. Right? This is the X-ray for practice. So that comes to about 12 cases of today. what you'll be doing, you'll be appearing for the test. That is one. And then day after tomorrow, you'll report 12 X-rays.
Okay, sir.
Right?
Yes, sir.
Yes.
And those who have not unmuted themselves, ठीक है आज के लिए, no worries. But from next time onwards, whenever the name is taken, at least say something. Say something. All right. So
Excuse me, sir.
Thank you,
Hello,
sir.
sir. When is the
Thank you.
test?
हाँ, go ahead, go ahead.
Sir, when is the test?
टेस्ट तो आपको खुद ही देनी है ना. I told you. You go to that YouTube, वहां पे टेस्ट है already. Appear for
Oh.
that test. Right? बाकी I am more interested now in Viva. Because today I
So,
realized that so many people, they are not even speaking. ये नहीं चाहिए कि it's not like that I am teaching only 10-15 students. It is for everyone.
so in ninth X-ray,
Again,
there was kind of bubble or something on the left lung.
over here you are
Ninth, no, ninth X-ray.
ninth.
Yes.
What do you say?
There was a bubble, a kind of bubble or something. Arcuminal,
This what you are talking about?
yes, sir.
That is the aorta, and because this is the area. This is the aorta who is showing this prominence. Right? As the aorta takes turn. All right. So thank you so much.
Sir,
Huh?
sir, what caused that air bubble to move upwards?
Air bubble won't be able, because if this is the diaphragm, air bubble will remain over there only. The trouble is when it is not present.
Okay, sir. Thank you.
So on Thursday, I was unable to attend that lecture. So what did I miss on that day?
What was the topic? So you'll get that lecture over here on our channel. Right?
I checked you didn't upload it on Thursday.
नहीं. Wasn't Thursday was नहीं third. Thursday was definitely uploaded. क्या बात करते हैं?
Yes, it is
I mean,
uploaded.
notes na? Notes is uploaded.
Yes, notes. I'm asking for
they are
that
there.
PDF.
They are there. They are there.
Okay.
Sir,
Sir,
हाँ
sir, where do
can
you
I?
upload this PDF?
हाँ Ubed, go ahead.
Where do you upload this PDF?
Asha, send a mail to me. I'll send you the link. I'll send you the link.
Okay.
Or should I put it in chat right now? You want it? Wait. Let me give you right now.
हेलो सर.
हाँ बोलो. Yes.
सर वो लैपटॉप के लिए डिजिटल बोर्ड चाहिए था, सो कौन सा ऑर्डर करूं? मैकबुक के लिए.
If your budget is permitting, so then go for Wacom. Wacom is best, but it is bit costly. And if the
सर मैकबुक के लिए आ जाएगा ना?
हाँ
मैकबुक के लिए आ जाएगा ना?
हाँ बिल्कुल, it supports. उसमें तो क्या, both the drivers are there, right? Both the drivers are there for the Mac as well as Windows. So no
Okay.
worries.
Thank you, sir.
Hello, sir.
हाँ
Actually, I didn't attend the lectures for the last week because I had eye infection. Should I still give the test?
you can. In case if any of the question comes which you have not studied, no worries, just mark it. But at least
Okay,
try
sir. Thank you.
to appear it. This is not
Okay,
like
sir.
say in case if the low marks are low, so then someone will be going for headshot. Like nothing like that.
Okay, sir.
No issues.
Yeah.
Thank you, sir.
Thank you. All right, send a mail to me. I'll post the link. Right, I'll give you the link for all those PDFs.
So 1 second, I had one more extra doubt. That test you mentioned on YouTube, is it General Anatomy Test 1?
That's why.
Okay.
That's why. Everything what we studied. Okay, so
Thank
thank
you,
you
sir.
so much.
Thank you, sir. Bye, sir.
Thank you, sir.
Thank you, sir. Thank you, sir.